let's start with our pre-briefing this afternoon. All right, let's flip down to, let's go ahead and just get our roles assigned, okay? So we talked a little bit about, well, camera can't see me. We talked a little bit about our roles in SimLab a couple weeks back and like what your responsibilities are. So I'm gonna hash out with 7 of you. Everybody's gonna probably have one responsibility on their own, okay? Sometimes I may let you select your role, but most times I'm gonna select it for you, okay? So let's go ahead and tackle, who do I want? I would like, dun, 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 Casey. I'm gonna have you be the primary nurse, okay? Primary nurse, you're going to be the one taking the basic intake, okay, of the client. The initial chief complaint and HPI information, okay? And then you're gonna go right into assessing your environment and then into assessing your client. Okay. So you're essentially gonna do more of a little bit of more condensed history for the purposes of SimLab because it is a 2-hour slot. Knowing in real time, you're gonna have a decent length of time a lot of times on patients collecting history. So you're going to do a certain form of a history and then, of course, a physical assessment head to toe, okay? You're going to demonstrate through the head to toe just as you would have done in health assessment and just as you would do on the unit, okay? Document your findings. So as we kind of start out, you'll see the basic demographics are just there for you. Perfect. We may skip over just a few minute ones, but the largest majority of this I think we'll be able to get, okay? For your assessment findings, you're going to go down by the systems and circle your positives, make extra comments if there's things that you need to add to in your documentation. Of course, you got a place for your signature, okay? You then are going to be that initial one that is going to put the problem list on the board. Okay. You're going to identify your problems, those focused key problems you're finding from that patient's presentation and from your assessment. Put them on the board so that when you see the physician with an S-bar, which is also what you're going to do, we'll have like a little format to follow, okay? Second form here is your S-bar, okay? You're going to follow your S-bar to the best of your ability. I know it will not be perfect this first time. But you're going to try to the best of your ability to fill in the blanks, some of the content that you pulled from interviewing him into your S-bar so you can get you some orders. Okay. I'm going to do a lab and diagnostic person, Sydney. That person also is kind of for a bit behind the scenes like the nurse educator. So you're listening from the point of the patient's arrival up till it's your turn for what tests were ordered, lab tests, and any diagnostic tests, x-rays, CT scans, ultrasounds, whatever. You're listening for those orders, and at some point I'm going to give you a handful of results, of data, okay? And you're basically going to culminate that data. You're going to problem solve what these results mean in reference to your patient, okay? Similar to what you would do on a care plan. You're going to tell me about them. First, what is this, what is a white blood cell count about? And what does this result mean in relevance to this particular patient? Why is it elevated? Why is it dropped? And so forth. I probably won't give a ton of labs today. Again, I want to keep my time going. But as we progress forward in the weeks, content by content, those labs and diagnostics will get more and more, okay? So when I prompt you, you're going to pause. You're going to have a board in there where you will jot those results down for a visual for the whole group, okay? And then you'll have your breaking point where you're going to share with the group what your lab and diagnostics mean and so forth, okay? So that's I think nursing is like solving mysteries, right? You're presented with a problem. It's really confusing and doesn't make sense. And your job is to go through all these interchangeable and solve it. So it's good. A lot of times for you guys to rotate the doctor role. So that you're always thinking, ooh, he needs a chest x-ray, he needs a CBC with differential, oh my gosh, he may need an ultrasound. It gets your wheels turning with problem solving, okay, and critical thinking. Why is it so important from a nursing standpoint to know what you expect? What happens if you call your physician, report off a very detailed SBAR with several critical problems, and you get 2 orders and you're like anticipating multiple? You need to know on the other end what you're expecting to be done for that patient, medically and nursing-wise. So not only are you just covering the nursing part, but your brain is thinking behind the scenes of, medically, what does this patient need for diagnostic tests, for lab work? Do they need a caseworker? Your job is huge, okay? So we need to get practicing on the other end of the spectrum, which is the physician. I want to center you in on the concept of sickle cell anemia, okay? You are beginning to start some content in lecture on hematology, immunology, okay? Sickle cell anemia, right in there, right in your content. So I want your engine to begin to turn on sickle cell anemia. That's our focus today, all right? I want you to start thinking about the pathophysiology of sickle cell anemia, how it happens. Tell me a little blurb about it. Where does sickle cell come from? Give me some pathophysiology. Genetic. Remember, when you're thinking conceptually about a topic, think in words. That's how I learn it, okay? So the first thing that I think of when I see the concept sickle cell anemia, right up there is my light bulb, and I say genetic. What else? What else do you know?
Shape, red blood cells.
Something with the shape of the red blood cells. They do what we call, in quotations, hence the name, they sickle. What does sickling mean to you? What do you think it means? I think of another S word. Shape. Okay? They sickle, which is essentially in a regular shape. What happens because of that? Here we go down the patho chain.
They get stuck.
They get stuck in the vasculature. What happens to your client? What are presenting signs and symptoms of your client?
Pain.
Pain is huge, okay? And it can be limb, it can be chest, it can be anywhere where there's vasculature, anywhere where there's arteriovenous movement can be sickling. So it can be in organs, which can be very dangerous. Any of the vasculature, right, can be dangerous, right, potentially. All right, Casey, so come on in. I am going to share with you that your client is a direct admit to your med-surg unit, okay? So direct admit means he came straight from the outpatient clinic, all right? Acute doctor's visit, and they admitted him straight to the floor. Okay. So just to solve that for you, you are not in the ER, thank goodness. You are on the floor, okay? All righty. You may proceed, Nurse Casey.
Hi.
Hello.
My name's Casey. I'm going to be your nurse today. Can you tell me your name and date of birth?
John Doe.
Okay.
6/28/1990.
Okay. And what brings you in here today?
Well, I can't breathe.
Okay.
In my chest.
What's going on in your chest?
I went to see my doc today. I woke up in the middle of the night. Just severe pain in my chest.
Okay.
And just heavy. Can't get a good breath. And he just sent me straight over here.
Okay. And when did you say this started?
I woke up at 3 a.m. this morning.
3 a.m. And you woke up with chest pain and you can't get a good breath.
Yeah.
Okay. Does it radiate to any other parts of your body?
I'm right just in the middle of my chest.
Okay.
And sometimes is at your shoulder blades. I feel like kind of to the top of my back.
Okay.
I'm sorry, I have trouble getting a sentence out to you.
No problem. Take your time. I'm asking you these questions. You say the pain's very severe. Does it feel like, is it a dull pain? Is it sharp?
Yes, ma'am. Dull and like an elephant.
Like an elephant sitting on your chest?
Uh-huh.
Okay. Does anything make it worse? I know you said coughing makes it
Just
worse.
this cough, my cough is so bubbly.
Okay, it feels bubbly. Do you
Yeah.
have a lot of secretions?
Oh yeah,
Okay.
lots of green stuff.
Okay. How long have you had those green secretions?
Oh gosh, I feel like I've had a cough for at least a good 7-10 days.
7 to 10 days.
Oh yeah.
Did you just talk to your doctor about this cough, or have you talked to them about it? Nothing?
All I know is as soon as I got in, he basically called the ambulance over and sent me over.
Okay.
I didn't really get my visit. Kind of wasted my money.
Does anything make your symptoms feel better? Anything relieve the pain?
No, ma'am, but I can't breathe right now.
Okay. Let me get some oxygen on you.
Could you sit me up, please?
Yes. Mm-hmm.
New set of vitals posted, Casey.
Okay. Ugh. Maybe. Okay. Okay. So oxygen is low.
Oh.
Do we have a nasal cannula on your book? Right.
Okay. So pause. This will be a moment where when you need urgent supplies as a primary nurse, you will then, your charge nurse or yourself can go to the red medicine cart and grab the appropriate supplies. If it's not set out what you are needing, you'll go into the supply cabinet and pull. Okay? So yes, oxygen on that client, immediate acute vital signs is critical. Good job. You need to get that client up a little faster.
Okay.
One of the most immediate things you're doing when you walk into that room is what? What are you looking at? What have I taught you in health assessment?
Looking at the patient.
Yes, get into that room. Get your eyes on that patient.
Okay.
And get your eyes on what else? The whole picture, your surrounding. Jerry says get your eyes on your surroundings.
Okay. Can we get some oxygen tubing? Oh, perfect. Thank you.
And the doctor's orders are for what type of oxygen and how
So
much?
you would suppose in your clinical unit, in your institution, you will probably have some form of standing orders or protocols. Okay? You familiar with that verbiage?
Yes.
In the event a client would need something in an emergent basis, there may be a standing protocol to get oxygen on that client without them standing before you. But you will need an order.
Okay.
Okay?
So do we have this oxygen?
So this is helping you get familiarized. So connect to your flow meter. Yep. And connect to your patient.
John, I'm going to put some oxygen on your face here, okay? Try to relax and take some deep
What is
breaths.
this? What is this you're putting on me?
This is just oxygen, okay?
What kind? Why is this such a mask? What does this look like? What is this? It's not like a cannula thingy.
It's just a mask that's going to sit on your face. It's,
Okay. What kind of mask has she got on her? Casey? What kind of mask does Casey put on her client? Jerry,
Nurse Casey has put on a non-rebreather mask.
Non-rebreather. Why do you like the non-rebreather, Jerry?
Non-rebreather mask gives the most concentration of oxygen for the patient.
Yep.
Especially with the patient being short of breath.
Very nice. Higher concentration of oxygen. So essentially, what can you do with your flow rate on your flow meter?
With this oxygen, we can go to the top 15
You can go to
liters.
15 liters. The oxygen is really not connected, but you're simulating through.
Okay.
And that is the routine that I want to see in all simulations, is you're literally simulating through from start to finish of a skill set. Okay, very nice. All righty.
okay, we're going to sit you back. Actually, before I do that, any tenderness right here?
No.
Okay, I got this side.
No.
Okay, we're going to lean you back. Sounds like there's some fluid in the lungs.
Yes, correct. crackles in the bases, predominant left base. The reason why I'm intervening on that is that sometimes with the simulator, as students are learning simulation, they have trouble defaulting between like the rubber in the body rubbing versus the actual lung sound. So there will be times with lungs that I will confirm to you what you are hearing, whether you're right, whether you're wrong, to keep you in the mindset of an issue. Okay? So you are correct though. So good job.
Patient's mental status, he's alert and oriented to place and time. He is cooperative. He is in a lot of pain though, coughing up a lot of phlegm. He has been having green secretions for about 7 to 10 days now. They're bubbly. His pain also extends back into his back and shoulders, but mostly right in the center of his chest. I think the problem is he has a lot of fluid in his lungs, and he's in a lot of pain, and then also possibly a cardiac and respiratory issue.
Okay.
Patient does seem to be unstable, in a lot of pain. We do need to do something. I suggest that we get some labs, put a Foley in. He's having a difficult time going to the bathroom.
Okay.
Probably get a chest x-ray. We also need to talk to the family. He needs some more education about sickle cell. He seems like he has a difficult time dealing with it. I didn't ask, but maybe some depression. He says he doesn't understand why this is happening to him.
Okay.
Very good.
Okay.
Very good. Did you hear that? S-bar. That is a good template. What she just did of how you can flow every week. Just like that. Use that assessment data, plug it in where it goes on the template, follow it down. Very good job. Okay? Now, my physician, I'd like you to take a stab, so to speak, at giving some orders to your nurse. Okay? And we're going to proceed on and take the next 30 minutes to do some interventions, practice some skill sets, and then perhaps reassess our client, and that's probably at the point we will, stop and then go to debrief.
Okay.
All right, so what are you thinking for orders, doctor?
So you mentioned that he was having pain in his lungs, chest area.
Yep.
And he's having fluid retention, so he has edema.
You want to go ahead and
He
write
has
your
fluid
labs
in
and
his
diagnostic
lungs.
orders?
Okay, so I'm thinking we'll get him a chest x-ray
Okay.
to see if he has any fluid in his lungs.
Okay.
And then a BNP lab,
Okay.
see if he has fluid overload.
Okay.
Also, because he is explaining that he's having pain in his chest and he has sickle cell, I want to have a D-dimer done
Okay.
and complete blood count.
Okay.
See if he has any elevated red blood cells, white blood cells if he has an infection.
Mm-hmm.
And then I also want to see if he check his troponin.
Okay.
See if he had an MI,
Okay.
since he says he has painful chest.
Cardiac enzymes. Okay.
So I'm going to add to that
Okay.
that you are going to do O2 on this client
Okay.
to titrate his O2 to keep it at 92% or above.
Okay.
Now, whether you meet that mark's to be decided, okay? Your client probably does need some arterial blood gases because he is if you are reassessing your client, I'm going to make a mental note here for you, or a point here. Common thing that happens in simulation, again, because this is our first one, we're going to stop and have a teaching moment. When you are doing your assessment and you veer off to do an S-bar and you veer off to put a Foley in or start an IV, don't forget about the patient. The patient watching your monitor. It's habitually something I see happen in sim because we are in sim, okay? So it's easier to get in the mold of, oh, let's do the IVs and let's give the meds, okay? So remember that as we move forward in the weeks, okay? Very nice start. So we will do that with the titration. You already ordered a CBC. I don't know if I heard you order a complete metabolic panel. Okay. I would like an IV of normal saline
Okay.
at 75 cc an hour. Okay. We probably ought to go ahead and do a sputum for culture and sensitivity.
Okay.
And I'd like to go ahead and hang a, let's do a broad spectrum antibiotic. Levaquin, 500 milligram, IV piggyback, Q24. And has he been doing a lot of coughing since he came in?
Yes,
Let's go ahead and do albuterol neb, Q4 to 6 hours as needed, please. And one more thing, till I get some labs back. Let's go ahead and do Solumedrol, 125 milligram, IV push, Q6. Actually, pardon me, BID. Okay? Let's get started with that, and then I want you to get labs back and call me back with lab,
Okay.
and we'll evaluate what we need for meds. For pain, what do you rate his pain?
I did not ask a numeric rating, but I can ask him real quick.
Okay.
He seemed like it was very severe.
So for your patient, your client, I'll pause. I'll save it for you. He's 10 out of 10,
Okay.
mid-sternal chest pain, okay?
Okay.
So we might want to initiate some pain control. I'm going to give you a farm moment here, and I will do that throughout many sims. Talk to me about a narcotic medication, if you know it yet, that helps to vasodilate. And it's given notoriously for cardiac and or respiratory crisis of some sort. And it starts with an M. You probably haven't had that yet. Who did it?
Morphine.
Morphine. Let's go ahead and give him morphine sulfate. 2 milligram. IV push now. I don't want to order any more till you reevaluate him.
Okay.
Okay? And you asked for a Foley catheter. Dr. Catlett, did you order the catheter?
Yes.
We'll do a Foley catheter.
Okay.
Okay? Gina will watch
All
to
right,
see that you're generally doing this correctly. But because your client is in respiratory distress, if I were you, I would get this med going promptly. Gina, I'm going to give him this stuff for the neb for him to get
Okay.
started. You'll pour this into the canister, and Gina will assist you through after she helps her start her line.
Okay.
That way you're getting to kind of watch some skills together, but not all crammed together. I don't know if that makes sense, but okay. Gives you some skill practice. Okay. I'm gonna go pull these drugs.
All right. Mr. Day, you're going to feel a slight poke here, okay? Oops. All right.
You can just pour it right into how you had it there.
Right there?
Yep.
Okay.
Okay. It's okay. Just always remember we can clean the mess up later.
Okay.
Okay, that's good.
Gonna feel a little flush here, okay?
All of it?
Yep.
Okay.
All right.
So he's alert and orientated, so I guess he could probably hold it
Okay.
to just bring the mask down. And you can go ahead and turn it on. Right on the side, see it? And then he sucks it in, blows it out. Once in a while, you want to tell him to take a really big, deep breath
Okay.
to get the medicine down in there.
Here we go. We dissolve it. Okay. All right, so that's your Solumedrol. So you added the diluent
Okay.
to the powder. Okay.
Really?
You've got that done. Let's go ahead and draw that up. I think you're still in the air.
It's not.
Come down just right through here. See that?
Yeah.
Get right in that water line.
okay.
See, some needles you might be loose too, but I think you were maybe not in the water line enough.
Okay.
Okay? Common mistake. Not bad. It's a learning curve.
Right.
Keep dropping your needle. Because the more you draw out, the lower that's going to get, right?
Right.
And it's going to be tricky to get it out.
Now I can see it.
How are you going to fix that hemoglobin of 8.1? A lot of your sickle cell clients, you're going to have to transfuse them. It would not be a normal hospitalization if you didn't have to transfuse a couple units of packed red blood cells in that hospitalization. It's a common fix. You got to give them back oxygen. Are you going to fix this oxygen level? Am I going to be able to fix this oxygen level without giving him some red blood cells that are oxygenated back? Think about that concept. Does that help you understand that? Okay.
Right now she's given 2 milligrams
Okay.
of morphine push and then,
You're at the bedside. What are very key things that Candy's doing at the bedside before she pushes this into her client? Dun, dun, dun. We are in simulation, so it makes it harder to get into the motion, but now is your chance. What do you do, say, ask before you push or give a client any medications? Okay,
Oh,
so we want to know.
his name. And
Remember the 3 checks back in foundations? We're checking at the Pyxis.
Okay.
Likely we're checking at the Pyxis Med Center twice, but that 3rd check happens right now. And what are you doing when you're checking that? What is that 3rd check composed of?
The correct medication?
Correct medication. What else?
The right amount?
Correct amount. You're verifying your order,
Right
aren't you?
route.
Yes. You're doing all the right amount, dose, route, sites, and so forth, right?
Right.
And even just as important, what else you need to do in that 3 check? Hi, John.
Make sure he's just assessing him in general.
Keep going with that mindset. Is he John Doe?
Yes. Right.
How am I going to identify that?
If he can talk, I'll ask him and then check with his bracelet.
Thank you. Okay? So don't forget those 3 checks at the bedside. Want to see it in SIM? Okay, now show me your technique. You've cleaned your line.
Yes.
You've now connected. And let's say our push time is what? Give me a
Time
med.
is going to, for morphine, is give slowly over 4 to 5 minutes.
All right, so morphine IV push, idealistically, it'd be over a 4 to 5 minute slow IV push.
Okay.
So depending on the push time is going to depend your technique in terms of how much you're spitting through there, you know, in little increments, right?
Okay.
Okay. He's got an IV of 0.9 normal saline going. I know you're not a pharmacist, but would you suspect that normal saline and morphine are compatible?
Yes.
Yeah, so you've got a line going. I don't believe you need to stop that, okay? But we're going to want to recap on patho. I would want Casey would be recapping on her nursing assessment and her findings. Sydney, you would be, where's she at? You would be recapping on your labs and diagnostics, the results and the relationship between what that patient had. I did not forget you. Jessica would be recapping on her focused nursing education points that were critical for this client. The whole group, Matthew involved in this because he was the physician, but the whole group participating, we would be focusing on the nursing and the medical interventions that were key for this client. Okay? What did we do for this client and why? Once you've done all this, you've just created a concept map. You then have a test over hematology, and your professor says you may have some, questions on sickle cell and pernicious anemia and da-da-da-da-da-da. This material is usable. This is part of learning. This is conceptually learning. Tell me some highlighted education points that you may have found for this particular patient.
Well, he had high blood pressure, so educating on how to get that under control.
Med education, okay.
The medication that he'll take when he goes home. If
Okay.
he takes some home. Since he's at high risk, have him get the pneumonia vaccine.
That's a good one. Health maintenance. That's a
Coping
huge one for
strategies.
NCLEX.
He was kind of confused as to, why he had this. So coping strategies, maybe talking to a counselor or something.
Counselor, case management.
And he drinks on the weekends with his friends. Maybe cut down on that.
Might be a problem with his sickle cell history. Nice.
And I put something that I can't remember the point why I put it, but I put red blood cell.
Something was,
I don't know,
you were having a moment.
Yeah, I don't know what that was.
Tell me, was this helpful to get your own chance to just sit in private and identify things as you were watching?
Yeah.